Welcome to another episode for DentalUnit podcast. I'm Tatiana de Liberador, speaking from the studio in Curitiba, Brazil, and with me, my partner, Dr. Cristian Scognamiglio, join us for Switzerland. Hi, Chris. How are you?
Hi, Tatiana. I'm super good and super excited because we're going once again. We're doing another episode together, but not only because we're doing another episode together, we have two amazing guests that I have the privilege to have worked in a few opportunities, and they have accepted to be here with us. And they are setting the standards for oral rehabilitation. I let you do the honors.
Our guests today are Dr. Cristian Scognamiglio and Dr. Alessandro Perucchi, both international speakers, key opinion leaders from Straumann, Newdent, and BlueM, and true master in implant dentistry. They work side by side, delivering impressive full mouth rehabilitation around the world. Welcome, my friend.
Thank you very much.
Thank you, Cristian. Thank you for the invitation. It's for us a really big pleasure to be here with you in this really important podcast. When we see the name that they come before us in this podcast, it's for us really an honor to be here with you today.
As Alessandro said, it's a great honor to be here, and we are looking forward to see what's going on and to cooperate once more with you, Tatiana, and with you, Cristian.
Thanks for joining us. Well, let's shift gears, and first things first. I would like to know, speaking of, you guys are known for your clinical work, but for the ones that don't know you, let's start with Cristian. Who is Cristian?
So, Cristian is a dentist, let's say a young generation dentist that decided to start a path of surgery, implantology, and prosthodontics together with Alessandro. We work together since now 8 years, and we really love to share our daily emotion and daily job together because we think that to be together, we can be stronger. I love, and Alessandro too, our own job. And actually, what I always think is that I'm always on holiday, even if now it's a holiday time, because I'm doing the job that I love the most. And so whenever I have to stop longer at the job, I love it.
And you, Alessandro, give us a brief summary of your resume, please.
So I am also a young dentist, even if I am a couple of years more than my partner, Cristian. I was graduated in 2005 at the university in Bern, learning implantology by one master of implantology, Professor Dani Buser. And then I was working a couple of years near to Bern. Then I moved to Lucerne in the Canton Hospital, where I did my specialization in oral surgery in the department of maxillofacial surgery. Then I decided to move back to the root, and I come in one beautiful place, the Swiss-Italian part, the Swiss-Italian speaking part in Switzerland, in the south, where I opened my dental clinic in 2012, and in 2015, I renovated complete my clinic. In 2007, I married my wife, so I found the second half of the apple in the private life. And in 2019, I found the second half of the apple in the professional life with Cristian, because we met each other at one party and we started to cooperate together. And we are just not partner in working, but also in the private life. We have a lot of fun together. We do a lot of sport together. We share family time together, and it's really nice.
Let's get straight to the point. Cristian, in your view, what defines the excellence in implantology with a focus on oral rehabilitation?
So, what I normally think is that in order to be a good surgeon, you need to know even something about prosthetics. So we love surgery. We are always focused on surgery, but we love the prosto part too. And that's why I think that in order to get the excellence, we need to have good background, evidence-based dentistry, And then, of course, good products that we can use on our patients, because at the end, what we want is the satisfaction of our patient, and the patient has to be happy. We make a medicine centered on our patient, focus on the patient. And of course, what we want in our daily practice is to have a long-lasting result. So what together we do, it's always to organize, to make a wow experience to our patient in order to make him happy and to create a new smile for the rest of his life. So we try to find the best product, evidence-based techniques, and to work with the best passion that we can.
I would say excellence is a buzzword, correct? But you do guys walk the talk, and that's visible, that's tangible in the how we see your work. Is there any? I will shift this question to Alessandro for now. Is there any specific protocol that you adopt to reach that level of excellence, or you just play by book? Or what is the twin approach to that level of excellence, Alessandro?
So I can tell you, Christian, we have two secrets. One is our motto, the Swiss tradition meet the Latin charisma. We take all the Swiss tradition route of evidence base, of research, of long-term result, and we adapt with a little bit Latin charisma, with new technology, with immediate implants placement in some case, with immediate loading, with full arch cases, but each time we document each case. And our secret is our partnership. Because if you are alone in your dental clinic and you messed up something, you could not speak with anybody. In our daily practice, each evening we share each other picture, we share each other comment, we share with me, with Christian, with our dental technician, with all the staff, and we try each day to improve ourselves. So my suggestion to all the young colleagues that they are listening to us is to document everything, every single step, and then to share the working impression with the expert colleague of you that you can improve each day more your technique.
And Christian, for you now, would you say that excellence requires a learning curve? And how can dentists plan that journey? What steps or advice you would give? Would you give?
So I completely agree with the first sentence that you said, because excellence and to make the best result, it requires a learning curve. That's why I remember one of my first implant was not an aesthetic area implant with guided surgery or a full arch. It was a simple implant, 3/6 on a healed side. And from there, step by step, I developed my passion, I developed my techniques, and this is what I am today. I'm someone that when I'm trying something new, I like to start from the very simple cases and then improve step by step, because the key for the success is to reach the success, not to block yourself on hard cases and to lose your passion for that job. So when we started with the digital, for example, implantology, like guided surgery, I remember we didn't start from a full arch first case. We start from simple cases, from cases that we could solve freehand, because we knew that if we had any type of problem with the guided surgery, we could just remove it and substitute the guided surgery with my own freehand technique. So what I suggest is to always start from simple cases and then step by step to move into more demanding cases. So this is my idea, because before knowing a technique, you need to try, feel it, and when you have it in your hands, it's like to play the guitar. You go.
Now, shifting gears to daily practice and teamwork, right? We always say there's a mantra, as you like to talk about mantra, that people remember a small percentage of what you say, but they do remember how you make them feel, right? And looking at both of you lately, not only the level of quality of your work, you take care of the collaterals, right? When I talk about the collaterals, is you're always together, you work together, you teach courses together, always with same clothes, backpack, watches. Some would say even similar underwear. it, how intention was this, and what was the thought process throughout this?
So what we want to show is that we are a team. We are a team in our clinic, and we are a team during our, let's say, work life. So even when we go on the stage, we feel together, we feel stronger when we are dressed up in the same way. Actually, everything started thanks to Alessandro, because he has this mantra to dress up in the same way with his family. And it's something that I want him to shift on my family too. So that's why now I have a little baby. She's a female, but I'm trying to dress up maybe with a pink bottom-down t-shirt together with my wife. At the job, we try to dress up together in the same way, in the same shop, and it's something that connects us. Like when we are doing, for example, live surgeries together. And then Alessandro, Cristian says something funny. Would you like to connect with this?
Yes, I have a really funny story. At normal, the only thing that we have not together are the underwear. But once we were traveling to a congress in Curitiba, and the plan was to wear white pants. And we have packed in our luggage just colored underwear. So we was at the airport, and we say we cannot wear colored underwear under white pants. And we went together in a shop in the airport, and we buy the same white underwear.
Oh, now I understand the history.
Everything the same, also the underwear. No, but joke apart is what you say, Cristian, that it's really important. People didn't remind everything that you say. People keep in mind one picture of you, the picture dressed up with the same clothes, the picture with the same watches. They remember, and maybe they remember a sentence, a number of your conference, and they go home and they associate these two guys that they are dressed up the same with this sentence, and they try to insert this in their clinical life, in their clinical daily life. And for us, it's a big honor, because nowadays, sometimes we met at conference people that they say, oh, I see you in Vienna, oh, I see you in Curitiba, and since there I remember the number 4 millimeter of the supracrestal, or I remember to take picture and to document each case, or I remember to start with the guided surgery. And for us, it's really important. Even if they remember a short part, it's important to give something that they can take home as a take-home message.
Oh, nice.
I agree completely. I'm a visual person, and I can connect a whole lot of information based on a situation that I lived, right? And it's the same. I agree with you completely, and congratulations for that.
Thank you.
Thank you.
And in your clinical practice, how do you divide the responsibilities? Alessandro, do you focus more on surgery while Cristian more prosthesis, or do you always collaborate in both aspects?
The only thing that we separate in our daily practice is orthodontics, because Cristian and me, we didn't cover the orthodontics part. But if we spoke about surgery and prosthodontic, for us, they come together, the two materia, because it's really important to manage both. And we have a big advantage. Me, I am right-handed, and Cristian is left-handed. So when we solve big case like a full arch, we always cooperate together in the surgical part and in the prosthetic part. And I manage the implant on the right side, and Cristian manage the implant on the left side. So we have not the wiki point to insert the implant, that for a right-hander is the second quadrant. It's really hard to see in a proper way. And the second quadrant is managed by Cristian, that is left-handed. For the simple case, we manage each case from the beginning to the end, both surgical or prosthodontics. And what I say before, we always speak together to improve more each case. We plan the case in 3D X-ray together. We do the pre-surgical planning together in the office, and then Cristian solves some case simple during the day, me too, and when there are the big case, we always cooperate together on the patients. Cristian, you want to add something?
Yes, exactly. So we think that, as we say before, a good surgeon is a good prosthodontics. Nowadays, there is not anymore the mindset, I'm the surgeon, I place the implants where there is the bone. Nowadays, we place the implant in a correct prosthetical way. So if there is no bone for that type of restoration, we reconstruct the bone and then we place our implant. Because if you follow this protocol, you will not then have problems in the prosthetical part. So we always work in a tight cooperation with our technician, because we improve even from our technician every time some better profile, how deep to place the implant in order to have the best aesthetic and long-lasting result. Unfortunately, just once a month, me and once a month, Alessandro, we do just surgery in one clinic of our friend, and there we cannot follow the prosthetical part. So we go there, we do the surgery, but it's something that we don't like, because we like to document from the start to the end in a good way. And if we miss the prosthetic part, we cannot present the case. We don't know how it ended up, the case, if the implant was successful, how was the aesthetic, how was the restoration. And you cannot ask the picture to another clinician that doesn't know how you work, how you want the picture. You are the only one that knows what to capture in your picture. So we think that a good prosthodontic is a good surgeon, and a good surgeon is a good prosthodontic. Right, Alessandro?
Right. And if I can add something, nowadays it's really important for the long time result of an implant, the supracrestal concept. And if you look the supracrestal concept, if you look the peri-implant mucosa around your implant, you cannot say that the surgeon is manage the peri-implant mucosa. You cannot say that the prosthodontic is manage the supra and peri-implant mucosa. Both together. You can manage with a less invasive second stage. You can manage with the emergence profile. You can manage with the depth of your implant that you insert. You can manage with the abutment choice that you do. You can manage with a lot of things, but they combine. They are coming together. Prosthodontic and surgeon together and not separate, because just in this way you reach really a good supracrestal concept and a really good peri-implant keratinized mucosa for the long time success of your implant.
And something really nice is that you are all invited, Cristian and Tatiana, when we are running, maybe for example in November, a course in our clinic. We have a date set. If you want to join us from Basel, Cristian is really close to us.
Yeah.
You can see how is it when we place implants together, or now when we do extraction in both quadrants together with the assistant that is behind the patient, me on left and Alessandro on the right one. It's something really interesting to see it during the live
very nice.
surgeries.
We need to do
I
a
would
picture for us.
Yes, we can do the video, but yes,
Yeah.
pictures. Alessandro has a folder on the phone of our pictures when we work together.
I have become a far better surgeon when I started to restore all my cases, because it's a loop, and vice versa. By the way, I started to do better prosthesis now, doing my own surgeries, now knowing the difficulties and what I will face ahead, and how much prosthetically one can destroy all the work the surgeon did, and how much the surgeon can do something the restorative person have to be totally creative to finish. And not necessarily creativity is good, because creativity may lead to a potential disaster afterward with a unfavorable emergence profile, angulation that is uncleanable, and on and on and on. I really like the way you express this closing the loop, right? Even though there's a role, more surgery, more restorative. But honestly, I feel sorry for the surgeons that do not restore their own cases, because it's so fun as well.
We completely agree with you.
Now,
Yes.
you said very nicely about we can document our case. And I'd like to touch on that one, because there's a topic very close to my heart, dental photography. And your photography is very meticulous, very well thought of. Now, how do you embed the photographic protocol within this workflow in a way that doesn't get in the way, but is also thoroughly documented? How is the process within the clinic?
So both we learned during our study and during our specialization to document each case. That is really important. I remember that in 2006, when I started to document my final specialization, I was to a photography shop in Lucerne, and I buy a good Canon camera. Many years after, we was on the way to Basel to get one lecture at the headquarters of Straumann, and we stopped in the same store together with Cristian to buy a better camera, because the dentistry develop each day, but also photography develop a lot. And we buy a new Canon, then we buy new flash, then we buy also something for the light to do a little bit smoother. And each day we try to document. But Cristian, it's not so easy to document each case. When we are doing surgery, we cannot deliver the documentation of the picture to somebody external. We have to do itself. What do you think, Cristian?
Exactly. As Alessandro say, just who is working knows what to capture in your picture.
Exactly.
So I've tried with Alessandro to try to let the assistants to taking pictures, because in this way we don't think about it, but it's way better to take it by yourself, because you know exactly what you want in the shot, you know how you want it, which photo you want. And so what we do is that we document as much as we can every case. Cases that we will present at the next Congress, cases that we just keep for us to improve, to see, and so on. And many times, for example, after placing the implant, when I watch it on the big screen, the pictures, I can then see something that maybe I can fix after. For example, an emergence profile really big that I see on the screen, something that I cannot see, not even with the loops in the mouth, we can then fix it after. So I think that document is not just to show off then at the congresses or to make a presentation, but it's even to let's say, correct yourself and to see if you did something wrong or if you did something amazing. So this is how we arrange it. I think that for a good photography, we don't need many photography courses and so on. With Alessandro, we have been doing many courses where they teach you a lot about ISO and so on. But then we discover that when we bought the soft boxes for our camera, we have satellite or lateral flashes. With these soft boxes, we did a course of 2 hours lecture online where they teach you 3 settings: posterior intraoral, anterior intraoral, extraoral, or single objects like the crowns before delivering that. And so with 3 settings, we can take all the pictures with lateral flashes, even in the posterior area. So this one was a shift that made our protocol of photography really easy and smooth through the day.
And we have to say there is just one negative point to document everything by ourselves. If we do the surgical part, we just use 1 pair of gloves. If you do the surgical part and you document with picture, you use per person 10 to 20 gloves per surgery, because you have each time to change and to recover your hand with sterile gloves. So this is just the only negative point. But what we discover is the using of a rubber dam that move the lip on the side, and it's easy to document the picture in intraoral during the surgery.
Now, lately, in order not to change so many gloves, what we have done is to take the sterile caps of the assistants, the one made of paper, to put it on the camera and to cut it just where you put the eye, and that's it. So in this way, it's easier, because it was like too much waste.
Keeping on the high level of excellence that you were applying, you just said, well, we try to delegate this to assistants, right? But there are certain things that your eyes know what you want to see, and it's hard to delegate what you want to see. That's something clear in my mind. However, to be the surgeons, to be the prosto, you can be the best that you can be. You have to surround yourself with a team that is equivalently to a level that you need, right? How is the workflow, the back office workflow in the clinic, and how do you keep them motivated, training? Or how do you ensure standard of care, not only yours but everybody else?
So it's really important what you said, because as you said, it's not just me and Ale, but we are actually 12 people in the clinic with all the other parts that are around. So we have a back office that is taking care of welcoming the patient, appointments. We are often abroad for congresses, so to arrange our slots to be like as most effective as possible. In addition, we think that assistants are actually a crucial and positive part of our job, because they help us to make our day better. So they are maybe not taking the pictures, but for sure they are the one that they are downloading them and are really putting them under the same patient and so on. So in this way, we save time in the cropping then of the picture. They are the one that they scan the implant and they put it on the registry, so that we can keep track on our statistics. They are the amazing support when we are working, and they are assisting us. We have many kits, we are many times in the limited market release of Straumann, Neoden. So we have many new kits coming into the clinic. And so once that we train them how they are the kit, they perfectly know when we use the new BLC, okay, the XL kit, keep it, and that's it. So they know perfectly everything. How we motivate, Alessandro is the master of this, and he will tell you what he is organizing every 2 years all together. So Alessandro, would you like to say how we motivate our staff to be, during our daily routine, a partner, a team with us? Because, Alessandro always told me, Cristian, we spend more time at the job than with our family. It's true. And so we need to recreate part of our family at the job. And so Alessandro, I think, is the model of, let's say, a dentist that knows how to keep and take care of the staff. I leave you the word.
Yes, thank you, Cristian. As you say, there are a lot of colleagues that they invest a lot of money and a lot of time to build their own home, their own family, but they didn't invest time in the clinic. In the clinic, you have to invest money because you have to develop each day. You cannot build a clinic and thinking that after 20 years is on a top level. You have each year, each day to develop yourself. And also with your team. You cannot expect that your team is following you if you don't give nothing to your team to create a good partnership, a good team. So, as Cristian mentioned, we organize each year many dinner together, and each 2 years we organize a team building. We was once skiing all together. We was once doing catamaran on the sea together. We completely divide us in 2 catamaran. Me was in one, Cristian was in the other. The 2 dental assistant who was best friend, there was divided in 2 catamaran, one in one and the one in the other. The 2 dental hygienists divided into catamaran. And then they have to cooperate in the catamaran because you have to do the things together. Otherwise, the catamaran cannot move, cannot enter in a harbor, and cannot do something. So you have to create this kind of team building to be sure that your team is function and working together each day. Because as Cristian say, we spend more time in our clinic than at home when we are working. And it's really good to come in your clinic and to feel like in a family. If you have this feeling, you can enjoy all the day long. And if you do something that you love, as we do, with a good field around you, is beautiful each day to go at working.
Do you have any open positions there? Tatiana and I may consider.
We can consider them if you want.
Yes. Another topic is passion. let's talk about passion, discipline, determination, and focus. How do those qualities influence a long-term success and excellent result in dentistry? Cristian and Alessandro, please.
So I had always the passion to be a dentist. Since that I was a 5 years old kid, my dad brought me to the dentist for his teeth. And I remember the dentist, and I came back home and I said to my dad, I want to become a dentist. And he told me, okay, this is a good job. It's a good idea. So since that moment, I never changed my mind. And this is what I am today. So passion is really important. As I told you before, I'm always on holiday. I'm working in the best team. I'm on holiday doing the best job for me. So I wish to everybody to find their own job and to do it in this way, because passion is at the base of the stimulation of everyday case. Because every case a simple implant, you can make it boring, basic implant, or you can make it more interesting. Here, let's try the new implant of Straumann, or no, I want to use the Neodent GM and do the cervix on top of it so I can really condition the soft tissue. So if you make it boring, like I have to go to job, I need to place my implant, this is not the way that I like to work. I like to be always like with and light from a passion. So passion has to go together with discipline, as you say, because discipline in the job is important. How you create a relationship with your patient, with the staff, and with your own protocol. So I create my basic protocol with Alessandro, and then in order to stimulate our passion and every case, we add some new things aside to the protocol. And you, Alessandro, how did it start, your passion?
As you say, by me it's the same. I was, since I was a little child, passionate about surgical. I wanted to play with this little game that was in Italy, the little surgeon, that you have to extract a piece of the body of the man without the nose it being red, because if you touch something, the nose was red. And I loved this game, and I was always excited to watch on the television film about surgeon, about medical, about all this stuff. And for me, passion is what moves the world. If you do something with passion, you do with your heart, you give all the best of you. If you do something without passion, just for money, you cannot do in the best way. So passion is really important. And that's what I want to motivate each of the young dentists that they are listening to us. Be passionate of your job. Be really full of passion each day that you are going to work, so you can develop yourself and you can give your best each day of your life for your patients and for giving back a beautiful smile to all the people that you met during your job.
I wish everybody was as passionate as you guys.
Yes. We love our work, né? Everybody here. And now let's talk about another topic. Clinical innovation in digital dentistry. Do you believe that having an open mind to market innovation results in different results in clinical practice?
I think that it's really important to be open-minded. So whenever the companies that we are cooperating with are proposing us some ideas and some new concepts, even in the digital world, we are always open to listen, to try, and to give our feedback, because especially companies that they are not from dentist to dentist, they are engineers, they don't know the reality of something that has to be handled by a dentist in the mouth of the patient. So we always like to give the feedback, and we are not that speaker that are always telling you, it's wonderful, Cristian, it's wonderful, this new system is wonderful. No, because they rely on us. They want to know the reality. They want to know how they can improve a product. And so we are always open to give the real feedback and to make sure that the engineers, they can get the point to fix it and to solve it and to make it better. For example, you were talking about digital. Digital is great. Alessandro now will tell you about artificial intelligence. We love digital because we know that is the future and we don't want to be behind. Many years ago, there were thousands of dentists that were placing implants without doing CBCT. And when you were talking to them, would you like to have a CBCT in your clinic? I do 2 CBCT per year when there is a cancer or I have to do a full arch. For simple cases, I don't need it. Nowadays, in all the clinics that you go, or in most of them, there is a CBCT, and every implant is placed with CBCT. So if you were that dentist that didn't want to know about the news of CBCT in your daily practice, today you are suffering because nowadays a patient comes in a clinic super modern with CBCT, feels the passion, feels the wow experience, and say, I don't go back there. And this is something that we don't want. So when came the idea of guided surgery, great, let's try guided surgery. We know that is not for every case because other way we spend our day planning the guided surgery. But in some cases, we have in our arsenal a new weapon to use. So we are always open. Alessandro, what about this artificial intelligence that is coming into our daily routine? Are we confident about that?
Yes, we have not to be afraid about artificial intelligence. We have always to thinking, did I am better or is artificial intelligence better than me? No, this is the wrong question. You have to ask you, did I am better alone or I am better me with artificial intelligence? And the answer is, of course, I am better me with artificial intelligence. But never forget what Saltman say when he create ChatGPT. You have to create rule. You have to create one status how use the artificial intelligence. And that's the same in the medical surgical part. You have to respect the rule and to know where I can use the artificial intelligence and when I have to give my experience in the project inside. And if I remember in 1998, when I was doing my driving license, I was driving a Subaru Justy without digital inside. And when I do to go back, I have to turn back and to look where I go. Nowadays, I didn't turn back. I look in the camera. I am assisted by artificial intelligence. I am assisted by a camera. I am assisted a camera around all the car, and I can drive on an easy way all the street long. So the same is in medical dentistry. If you want to achieve a good goal in implant dentistry, in the surgical part, and if you are supported by good company who create good digital tools, you have to use it and make your experience easy as a surgeon and make what Cristian said before, a wow experience for your patient. Because Tatiana and Cristian, imagine if I come to you and I catch you in my Subaru Justy for 1998 without optional insight, and I am a Uber driver, you don't have a wow experience. But if I come with a new complete car, with screen inside, with all the LED light, with everything, you stand in my car and you say, wow, that's a great driver. And the same is in dentistry. If you go to a clinic that they are stopped 20 years ago when there wasn't digital dentistry in implantology, the patient didn't have this wow experience. And if they can register itself for their appointment by the dental hygienist via web, if they come and they see the pre-planning of the surgical part with co-diagnostic, with combine of DICOM and STL together, you do the extraction and you see exactly where was the root of the tooth extracting the socket. For the patient, is that a wow experience? So you have to use the digital tools for you to make your life easy and for your patient to make a wow experience.
And exactly, as you say, artificial intelligence doesn't have to work alone. Even co-diagnostic, when they are doing a match, we always have the possibility to change. So artificial intelligence is not substituting us, but has just to assist us because we are better with artificial intelligence.
Hey, you guys hit the nail in the head. If we look not too long ago, when milling machines and digital technology started to become a reality, there was a big, certain dental labs, they started to get very worried, right? But now today, dental labs have never worked so much because they adopted the technology and they could give one step further, correct? So what it was a fear, the fear of the unknown, once it became known, now is an ally, correct? And it's the same. I agree with the artificial intelligence. Uh, even for us to make clinical therapy safer, what you mentioned just now with the virtual extraction, or all these sites that are potentially unknown territory that you will just find out when you are there doing the surgery. Come on, now we can prototype a patient. We can rehearse a surgery on a bench before we touch the person. Hey, how beneficial this is. So I see, as you guys said, with very positive eyes, and I welcome the digital technologies and AI as well. Of course, it's unknown, and of course, we also don't know the negative aspects that may come with. But so far, I see with very good eyes. Speaking of digital technologies, you guys master also. You are early adopters of the digital technology. This is visible in your work, right? And I was curious about this adoption, the learning curve, the investment. Was it gradually, or you just said, all right, I want one of these, one of these, one of this, one of these? No, you didn't, right? You take one step at a time, but then you mastered that instrument, then you mastered the second instrument, and then another one. How was the learning curve? And if this is today irreversible in your office?
I think you have always to be upgraded. You cannot reach your knowledge in digital dentistry just in 2 days. So for me, and for Cristian also, was developing slowly. I remember when I was using in 2006, one of the first co-diagnostic product was a great product at this time. But if I think nowadays at this co-diagnostic, I say, oh, wow, what it was. It was a good software for this time. And then it developed slowly. And we develop in the dental clinic also slowly together with co-diagnostic, with the Smile Cloud, with the artificial intelligence, with the picture that we take, and you have to learn it. I am a little bit afraid about the new dental technician age that they are coming, because they didn't learn the manual part. They just started learning digital. So for me, it's really important always to combine both the manuality, the old tradition way, how to build a tooth, how to create a crown, and to combine together with the digital part. It's really important to do both things together and to develop both things together in the same way. So you are able to manage each of your case on a great way. What do you think, Cristian? Can we nowadays avoid the digital part in our clinic? I didn't think that.
So I think that digital is inside in our daily life, starting from the pictures. So if we want to start from the very basic of digital, or from the presentation, we are not using any more slides, with that machines that was used 25 years ago. Nowadays is everything digital. So everything, as we say before, step by step. Even in the presentations, you start from basic things, you start to develop one case in a good way, then you become more skilled. Same in co-diagnostic. When we started with co-diagnostic and they propose us to learn co-diagnostic, we say, no, stop. Here we need to learn, because you cannot start something that you don't know in a random way. So we went to Poland to do a course of co-diagnostic. We learned the co-diagnostic, and when we came back, even if we have been learning full arches, stackable guides with magnets, and so on, which one was the first case, Alessandro?
An easy case that we can manage also if you cannot use the digital part. Start learning from easy to difficult case.
And after, we went through the stackable guide. Then we did our first course with guided surgery in our clinic. We did a simple case, an immediate loading of 4 lower incisors. And then the time after, we became confident with the stackable guide, and we perform a live surgery with the stackable guide. So everything is step by step, but you cannot avoid it. Has to be like this, because other way you can just do disasters. If you start from a full arch and then you just go in a guided way, and then you remove the guide and your bridge doesn't go because maybe you didn't pass the bone profiler and you are in panic, that's a dramatic situation. So you have to start from the basics.
I remember one thing when I was coming in the southern part of Switzerland in my clinic. I just say to the dental assistant, okay, since next month we will start with digital. We have digital medical history, we have digital agenda, and they was all in panic. They say, no, how I can left away the agenda in paper? I say, you will see, it's great. And nowadays, if we have to imagine to go back on the paper agenda, and if a patient call in our region, there are a lot of people calling Bianchi, Rossi, or Verdi. If it's called one Mr. Bianchi and say, I have an appointment, yeah, to whom you have an appointment? To Dr. Cristian, to Dr. Alessandro, to Dr. Giovanna, to a dental hygienist? I didn't remember. So they have to take the paper agenda and to look in each page where was the appointment. Nowadays, with digital, you put the name in and you see in a minute, or together with the phone is connected to the PC, and when the receptionist answer, already know who is the patient. So digital must be part of your life. And what we always say in our dental congress, Cristian, is digital dentistry. Try and
you will not be disappointed.
thank you. We was not prepared, but you finish on a great way.
I love the accent. You will not be disappointed.
Now let's change a little. You are key opinion leaders from Straumann, Newdent, and BlueM. And do you believe that work with top-level products support clinical excellence results?
So, as we say at the start, the key in order to achieve excellence is to have passion, background, scientific research, and of course, the best products that are on the market. That's why we, together with Alessandro, we went through different brands of implants. And when we found the right one that we really liked, we decided to stay with it and to cooperate with the company in order to make better products. So, now they are coming to us and say, try this implant, I give you everything for free, you become opinion leader and so on. But we cannot talk, put the passion, put our heart for something that we don't believe in it. So we think that in order to achieve excellence, one of the most important bricks, together with the other one that we have already talked about, is to have good products with evidence base. And that's why we are talking for Straumann Group, including Neodent, during our daily speech, and we don't use other brand of implants. BlueM is aside, but together with Straumann Group, especially in Brazil, because it's a great product, and we use it for every dental treatment that involves or crowns, or even fillings when you put the matrix, or parosurgeries, or implantology, or socket preservation. We always use the BlueM. So we believe in it.
And if I can add something, we are located in Switzerland, and one of the most famous sport in Switzerland are ski running. This year we gain a lot in the ski running. And this is a good example, the ski running, because you can coming down from a hill with each kind of ski. You can use each kind of ski and you're coming down from a hill with snow. But if you want to gain the World Cup, you must have on your feed one top product of ski. And that makes the difference of this 0.01 second that give you the winning time for the run. And that's the same in dentistry. There are a lot of screw on the market. There are a lot of product on the market. But if you challenge yourself with the best product, you can achieve excellence. And as Cristian mentioned, not just the screw brand, but also the brand of all the product to take care of all the oral peri-implant mucosa around your implant, create really a good result, create a wow experience for your patient, and create an excellent status of your work with long-term results.
Well, as Tatiana said, excellence as the topic of this conversation, excellence is not by accident. Excellence lies on the details, right? Details matter. And now shifting to details, you both are opinion leaders for elements of the Straumann group, right? Within the Straumann company, also in many ways, also for Neodent with ceramic implants. And within that array, you are also opinion leaders for BlueM. And how did this come into your world? Because what I see from your work, you praise for excellence. So as details matter, I trust that you choose products to match that, not only from the planning, execution, but there will be the aftercare. There will be impact on healing. There will be maintenance. There will be post-op. How this all came together. Bottom line, how did BlueM got to your life?
So, as you know, we told you that we are really open to try the new products that are on the top level. So we were using, as every clinic in the world from the school, chlorhexidine. And we all know that chlorhexidine had cytotoxicity, it kills bacteria, and then it changes the phenotype and they come back even stronger. And so but everybody at school learns to use chlorhexidine, except in Ilapeo that today is a chlorhexidine-free university. So this is something amazing. And we know that it's really important, the surgery, the prosto part, and the maintenance of the patient. That's why we do recall every 6 months for dental hygiene. That's why we want the first month after our surgery is a crucial month for the future healing and for the healing of our patient. And so we want the best product. What we saw is that me and Alessandro, we are always watching on something new. We are in many groups of dentists and so on. And we started to see now how many years ago, like 3 years ago, I think, when there was the last Neodent Congress, World Congress in Curitiba. A few months before, we saw that our friends, speakers, even for other brands of implant, they started to use BlueM. And we say, we would like to try this BlueM because we saw that the cases, they look good. And we started to investigate oxygen, chlorhexidine-free, the effect of lactoferrin, like in many dental treatment, not just implantology. And then we had the chance to meet, because for me it was an honor to meet Dr. Miseli, because I studied many articles of his umbrella technique, and we met him at the same hotel where we were staying, together with Johan, that is actually together with Fokke, the CEO of BlueM. And since that moment, we started our partnership. They let us try these amazing products, and we discovered that we cannot go back. As Alessandro said, I cannot go back on the manual agenda. I want now the best. And that's why for the healing of our patient, we decide to shift completely on BlueM that has an aftercare product that goes from the rinses to the fluid for the post-surgery and to the gel. And then they have many other products for the daily care. What about you, Ale? What do you think about these shifting points?
Completely agree with you, Cristian. To reach the excellence, you have, as Jerry say, always research new product, but also take the opportunity. We was sitting early in the morning at this breakfast, and you come back to me and you say, oh, I met Dr. Miseli, he's there eating breakfast with us. And then we move to the same table, we take this opportunity, and we start using this great great product. Not just the gel, but all the components that there are inside. They are really loved by our patients. They love this philosophy of the oxygen-bound healing, and we reach really, really good result.
And as Alessandro said, before, we want excellence, and we never have to stop thinking that we don't have to think that you are the best and you close yourself in your clinic. The relationship with our colleagues, with other speakers, is really important because you always learn from the others. So every time we go to a congress, we follow other lectures, we see one product, we get interested, we read, we try to use it. And this is, I think, even another key of our excellence, to never think that we are the best, because we are not. There are many clinicians that are better in other things. Everybody is special, and to never stop learning.
Yeah. Can you talk a little about mechanism of action, clinical indication, and your protocol using BlueM products in your practice, please?
Yes, first of all, we have to understand how it works, this fantastic oxygen product. Because if you put oxygen in the mouth of a patient, it will disappear in a really short time. This product have inside sodium perturbate who keep the oxygen and release the oxygen on a slowly way. And that's one of the most important topic of this product. The second, if you have to learn a little baby, Cristian is being a father since a couple of months, and me, I am father of 3 big children. And at the beginning, the mother of the children are feeding the children, and they are feeding with milk. And in the milk is inside lactoferrin. Lactoferrin is a really important product because it help us to do again the bacteria. So it's an antimicrobial product. And it's really important to have lactoferrin inside of our product, not just in the gel, but also in the mouthwashes and in all the product that you are using at home. And the other topic is that you have a healing of your patient without kill cells. So chlorhexidina, it's helping you again the bacteria, but it kills the bacteria and at the same time kill the fibroblast, kill the osteoblast. With this gel, with this product, you have a really good antimicrobial effect without have a problem of killing the good cell. Cristian, can you explain a little bit our protocol? We didn't just use the BlueM in our clinic, but we motivate each day our patient to use it also at home, this product.
Exactly. As Alessandro says, it's an amazing antibacterial, let's say, product. And it's really important because thanks to the lactoferrin, it goes to reduce the inflammatory factor IL-6. In addition, what we have is that it's actually even an osteoinductive product. And so it's actually good for osteointegration. And so it's good to use it on a place where we have placed an implant. In addition, back in past, we saw many cases where people, in order to reduce the bacteria in this supracrestal area of the implant, they were putting chlorhexidina gel or other sort of gels directly on the screw and screwing your crown on the top of the implant. Well, most of the gel on the market, they contain oil, and these oil are actually lubing our screws, and so our final torque is not exact the real torque. And especially when you are using precise products like the new Neodent Z implant, where the final torque of your prosthetic has to be 32 Newton, not 39, not 25. If we are lubing a screw, we are not achieving a perfect torque of crown on the top of the implant, the torque that is actually tested by the company for the movements. And so we decide to use BlueM because it doesn't contain oil and we can apply directly on the screw. Our protocol, as Alessandro says, that every moment that we rest during the surgery, we apply the gel. I give you an example. we are waiting the provisional bridge after an immediate loading. We apply BlueM and we wait the bridge coming from our technician. We are putting a simple implant, we put the stitches and the patient go home, we apply the gel. So every moment that we have a moment of rest from our procedure, we apply the gel. When we extract wisdom, we rinse with the fluid that has a lower concentration of the gel, and then we even put the gel before the patient leaves. As Alessandro say, we need to let it work a bit, because if you then straight close your mouth, the gel goes away. And so what we try to do is to put the gel and to leave the patient at least 3-4 minutes with the open mouth. So the gel, it's starting, you really see the activation of the oxygen with this micro bubble inside in the gel. And so there we know that the gel is going deep into the tissues, bringing oxygen. And Cristian, what we want in our healing, our body is creating new vessel when we cut ourselves to bring blood, because in the blood we have what? The oxygen.
The oxygen, yes.
Oxygen is really important for the healing. And if we bring directly oxygen into our wound, this one can be the switching point for a better healing. For the daily care to the patient, we always give after a surgery to do the mouth washes 3 times a day and to after apply the gel for the first 2 weeks. So this is the basic protocol after surgery. And then we have the other products that the patient can use, like the classic mouthwash of BlueM, not the fluid, and the toothpaste with the surgical brush.
Very nice protocol.
I was just curious, Alessandro and Cristian, as you've been using regularly BlueM in Switzerland, correct? We know how well distributed and how well promoted under the Brazilian territory. And how do you perceive the European accessibility, the European perception and adoption in this?
So I think that nowadays in all the European country is a distributor who distribute BlueM for each country. Also for Switzerland, we have one distributor who create also one beautiful website that the patient can buy directly from this website located in Switzerland. In my opinion, the switching point in the future for a country like Switzerland, where you send all your patients to the pharmacy to buy the product after surgery, it will be that in the future, each pharmacy will be covered with BlueM. So it's an easy way for the patient to get this product, because we give this website to our patient that they can order the product, but it's not so easy for the older patient that they didn't use internet and they go to the pharmacy to get in. Nowadays, we have a lot of pharmacy around our clinic that they are starting cooperating with BlueM and they can sell, but it will be really important in the future to create this networking of the pharmacy around each country.
Not just in Italy, exactly, around all the European countries, because as you say, we give the medicines, the antibiotic, the mouth rinses of BlueM and the painkiller, and they can go to the pharmacy and buy it directly. But for dentists, all the countries that we have been speaking around the world, in Europe especially, they have a representative for selling BlueM to the dentist.
Well, you just mentioned about European distribution of products. And speaking of European and good things, one last thing, you both often refer to a concept that is called the Latin charm. Even though you're European, what does the Latin charm mean to you in a context of dentistry? I'm super curious about that.
So, as Alessandro said, he is the Swiss tradition because he graduated in Bern, where the main focus of dentistry is about history, evidence-based, long-lasting result. I graduated in Italy, so they call Italians in Switzerland the Latins, because we are like, we are more like Spanish, Italian, Brazilian, so we belong to this Latin charisma. In my school, actually, they were teaching me, yes, about evidence-based and so on, but they started to talk to me since the very start about immediate loading, guided surgery. And so when I came to Switzerland, we didn't fight together. Many people, the problem in the clinic is to fight because we don't have maybe the same ideas. Actually, what we say is, Alessandro, you know a lot. I know a lot. Let's put together so we know more. So we decide to merge together our background, our knowledge, not just in surgery, even about prosthetic, for example, on natural tooth, how to prepare a tooth, chamfer or BOPT. And we didn't fight. We matched together and we created our own philosophy in preparation, in surgery, for example, to do immediate loading, just perfectly when you have the primary stability for immediate loading. And not to do maybe an immediate loading, but an immediate delivery of the restoration. So a bit more, not like a cowboy, maybe the tooth is a bit lower, but is not in contact. So we matched together, and so we created that the Swiss tradition meets the Latin charisma. And this is something that I would like to shift, Alessandro, to the companies that we are working with, right?
Of course, because also the Straumann Group company meet the Latin charisma of the Neodent company, and we see that they improve each other to increase the level of perfection each day together. And that's the way that we move in our daily routine, but not just in implantology, Christian. How we communicate to our patient. If you communicate too much on a Swiss tradition way, you are really a little bit close, and maybe the patient didn't accept the treatments. If you communicate too much on a Latin charisma, on a Latin charm, as you say before, it's also not good because the patient say, I am a patient, I am not your friend. So you have to find always a swift point between the two lines and find the right middle way between the two lines. Because try to be romantic in Swiss German. It's really difficult. It's more easy to be romantic in Portuguese, in Spanish, or in Italian. But try to respect someone in German is more easy. So you have always to find your way, how you communicate to your patient, to your dental assistant, and it's always this Swiss tradition that meets the Latin charisma in all our life. Even if we are speaking in the airport, when we go buying a sandwich, if we go there and we just buy the sandwich, it's just something that happened during the day. If you are coming, buying the sandwich, and you spend some more word with the people who is selling you the sandwich, you create an experience for you and for the people who is selling you the sandwich. So this is our daily life, always to be with precision, but with a little bit Latin charm and Latin charisma.
I have to say that actually even the place where we are located, it's fitting our motto, because in this part of Switzerland that is 5 kilometers from the border of Italy, we have the Swiss precision of healthcare, post office, services, taxes, salary, with the Italian charisma, with the good food, because it's coming directly from there, with the people that are really, let's say, open and with this Italian charm. And so I think this motto is actually perfectly describing our heart for the companies that we are talking about, Straumann and Neodent, our lifestyle where we are living, and our mindset with the people.
Oh, very nice. Amazing. Amazing. And now I want to say thank you very much for our conversation, for this rich and inspiring conversation. Thank you very much for you share your clinical experience, teamwork, and passion in dentistry. Thank you, Cristian and Alessandro, for stay with us and this DentalUnit podcast. One more episode.
We must thank you, Tatiana, and thank you, Christian Jerry, because Christian mentioned before that we are always inspired by other speakers in the social media. And when we see your picture, your case in the social media, you are for us also an inspiration. Christian, you publish shortly beautiful macro picture of macro geometry of implant. Lovely, really lovely.
Thank you.
I publish always a good healing case of soft tissue, and for us it's an inspiration to improve us much more in this product of oral oxygen therapy. And we want to say thank you also in your language. Obrigado.
Obrigado a toda a gente for organizing this.
And it's really nice to be here on this podcast. Really, thank you for the invitation.
Thank you so much, because we know that it's not easy to coordinate two countries from such a far away point of view. Like different time zone and so on. And we always follow you. We know the names and the people that were at this DentalUnit podcast by Tatiana and Cristian. And we are really honored that you ask us to share our idea and our mindset with you. And thank you for organizing that, because we know that nothing is coming easy. Everything has a background, and what you see on the screen is just the cherry on the cake. But behind there are emails, messages, organization. And so thank you from the heart. And Alessandro, obrigado to you too, because you are always the best friend, best partner in job, and best clinician.
Oh, nice.
Obrigado, Cristian. Thank you.
It's exactly this atmosphere of colleaguism, camaraderie, that we believe that we would like to give voice in the DentalUnit podcast. This was created with a lot of good intentions, a lot of effort, but literally is to give back, right? We think dentistry is such a rewarding profession, and we have been blessed, I believe, the four of us, but I speak now on behalf of me and Tatiana. We've been blessed by dentistry. We are fortunate to have chosen that profession, and just to give back and give a chance for other colleagues to put their voice out. This is already by far very well paid, even though we don't get paid. And with that in mind, I thank you both very much for taking the time on your precious vacations, Alessandro and Cristian, for stopping, giving a bit of a pause in your tough, busy daily work to be with us. Thank you very much.
And I'm really happy that it's work everything fine, because at normal, when we speak together, we are on the same place. And we have a lot of secret gesture that we do when I have to start speaking, when Cristian have to start speaking, when he want to say something and I have to finish it. And this is the first time that we managed this from Corsica to Switzerland to Brazil and to Switzerland in Basel. So it's not easy to manage this. It means it's a good team working, because even if we are not on the same place, we can manage such good discussion like today.
So don't we have some open position, Alessandro, because we are a great teamwork all together here.
Hey, I will accept Cristian and Tatiana in our team.
Yes, thank you.
Send me and we will speak about it.
Very nice. Thank you, guys. Thank you. Have a good vacation for you, Alessandro. And
thank you, Tatiana. And see you soon in Curitiba in September.
Perfect.
And I hope to meet you also
if you are in Curitiba for Abros, let's stay together. So in September. So I think it's 11 Abros, or in Curitiba, we are there from 13 to 17.
Yes. And 14, we have a good barbecue in my house. Oh.
Beautiful.
Rodizio de carne.
So, Cristian, we hope to meet you also soon in a congress or on a social event, or in Basel at the headquarters. It will be a big pleasure for us.
Looking forward. So I will close, and on this positive note, to all of you listening and watching this episode, thank you very much for taking the time you spend with us. And make sure to subscribe, to give it a like, and recommend to your friends. It's really important to us. Until the next episode. Ciao.